with daily aches and pains, and maybe you think it's just a sign of aging. While you can't control getting older, you can help slow down that process, what it does to your body.
Yeah, this is really interesting. It all starts by taking control of your health. Dr. Minni Malhotra is here to explain, along with her patient, Regina Campbell. Welcome to you both. It's great to see you. Regina, we're going to get to your story in just a moment. But Dr. Malhotra, I want to start with you and Anchor Wellness. First of all, you're a board-certified doctor practicing family medicine, but you believe in anti-aging through regenerative medicine. Can you explain?
So I am a board-certified family physician, and I did that for 15 years. But unfortunately, I was not able to get my patients better. So I was always looking for something through my personal, stories that happened with my family and me. I was looking for answers that how I could resolve their issues. So I took this route. I attended a conference and I went into functional medicine. So getting to the root cause of the chronic health issues. And I really got excited because it gave great results. But just doing some simple changes, you could actually resolve the chronic health issues which had been going on for years and years.
What's really interesting when you say is getting to the root of the problem. Some people just have the complaints of, you know, I'm getting older, I don't have as much energy as I used to, and chalk that up to age. But there's maybe some other things happening, and not necessarily prescription should be the first go-to.
Yes, so drugs are not the solution to chronic health issues. Yes, acute care, you need something for a cold or pneumonia, you broke a leg, you need that. But for chronic health issues, you cannot follow the acute care model. And you have to do a different solution. You have to come up with a different solution. What's actually going on with that patient? You got to listen, you got to hear them out and actually find out.
All right, so let's move on over to Regina, because you were dealing with all kinds of symptoms, Regina. Can I say your age on TV, by the way?
Go right ahead.
Okay, so 60 years old, which I sort of think is not true because you look much younger than that.
Thank you.
But you were dealing with all kinds of issues, arthritis, high blood pressure, high cholesterol, and just constant aching all over your body, right?
And underactive thyroid as well. So there was everything that was going on, and I thought it was just something you just accept at my age. And I had gotten used to living with it.
And had you, at that point, had doctors prescribe medications?
Yes, I was taking medication. Yes.
How many medications would you say you were?
Three medications.
So every single day?
And
every
with those
morning.
medications, did you notice any difference?
Well, it took away the symptoms, but it didn't deal with the cause.
Okay, interesting.
So it allowed you to get through the day. It allowed you to get through 8 hours, but that was it.
And how did you find Dr. Minni?
I saw a Facebook post about a free dinner. And so I thought, well, I'll just check it out. And so I went and I listened to her, and she talked about helping patients like me. So I booked an appointment as soon as I could get in, and she did some testing, and the rest is history.
And it's so interesting. I'm reading here that what Dr. Malhotra did for you is that through the testing that you two did together, you discovered, Regina, that you shouldn't be eating things like red meat because that was contributing to pain and inflammation.
Red meat, eggs, rice. There's a number of things that were causing me to have inflammation, arthritis in my knees, and things of that nature.
And once you started eliminating those things from your diet, did you notice a change?
I went through a cleanse. I slept better. My mind was clearer. I didn't have as many aches and pains. Some days I have none. I'm perkier. And I'm a lot more fun for my husband.
Gotta love it. I love this functional, what you call functional primary care, and a natural holistic approach, because even though you were taking the meds that you needed maybe for high cholesterol or blood pressure that you were on, but the other things that were contributing as far as the inflammation, I mean, I feel like it needs to be looked at, the body needs to be looked at a whole and not just these symptoms.
Yes, so you know, you are always born with a set of genes. You can't get rid of those genes. You'll always be predisposed to certain things, but that doesn't mean that you have to be predestined or you have to have that disease process if you just eliminate a few things or change your lifestyle in a certain way.
So would this start with a simple blood test, or how do you get your patients started?
So we don't start with the blood test. We actually first listen to the patient. So we take a very detailed history, which takes them about 2 to 3 hours to fill out the paperwork. We get from before they were born to present. We get the whole history, and then we find out that what could have, you know, triggered this chronic health issue. And once we know the trigger, we then start customizing their panels. So what everybody doesn't get the same panel of testing. It's customized based on their history and their issues that they are having. And once we get the panels are just a tool, to guide us. But the real thing is actually listening to the patient, seeing the environment, because you can tell them to eat well, you can tell them to exercise, but what if their life sucks at home, or if they have a bad boss at work? It's still not going to give them the results. So you have to give them all the tools to get better.
Well, and an
how she's so
interesting
real.
bonus, by the way, you are very real, doctor. Interesting bonus is that, Regina, all this extra energy made you lose some weight. I think we have a before and after photo. Can we pop that up so we can show the viewers?
That is not you.
Okay. Well, you look gorgeous in this
Thank
photo,
you.
by the way.
That was 6 months ago.
6 months ago.
Wow.
You look great.
Thank you.
You look
Thank you.
awesome. Glad you're feeling better.
Thank you.
Okay, so